Hello everyone, welcome to my brand new series, Dental Checkup in English. In this series, I will show you how we walk through a general dental checkup consultation one-on-one, which is have the following parts: the shape complaint, the clinical findings, the treatment plan options, the prognosis, and the actual treatment procedure. This might be helpful for those who needs the dental professional vocabs and methods to communicate with the patients in a daily basic practice. Now, let's begin with the very first case. So now we take a look at the patient here. He's a male Caucasian under 30, showing to the office with the shape complaint of the residuals, milk tea in the upper arch. As you can see here, now he has this one is the milk tea. Yeah. Okay. Now, he has an impacted canine up right here. You can see it's under the gum. So, his main concern is the whether he should remove the milk tea and put an implant on it, or he should pull out the impacted canine and put it in the right position. Which one is better or worse, and what else he should prepare for the treatment. So, as I say, I have a general checkup for him, and I will give him the overall treatment plan, what do we need to do. Elsewhere, the milk tea here, I have an x-ray to show what's happened underneath. Now, as you can see, this is an x-ray. So we have the milk tea with the roots has not resolved yet, so it's still intact and not very mobile in a clinical situation. Furthermore, he has class 2 cavity on the distal of milk tea. He needs to fill it if he wants to keep it. Furthermore, you can see the impacted canine here. This is the impacted canine. It's pretty far in the label. So if you want to put it down, then we have to expose the gum and to show the label surface of the teeth, and we have to use the force to pull it down somewhere else. So the best option, I think, for him is to do the orthodontic treatment, but he needs to take some time to do it because it's gonna take him around 6 or 12 months or so to first remove the milk tea and then, as I say, expose the label surface and then pull it out in the tooth arch. But you have to open the space, so it's now the current situation, it doesn't have enough space for the real canine to pull it in because it's kind of big. So just for only one teeth, but you have to do the braces or the clear aligners, the whole arch, not only this one. So it's gonna take him some time, some effort, and some money to do it. So we need to discuss that, and he needs to understand. Furthermore, if he wants to do the implant, still the same story, he doesn't have enough space. So we need to open the space again and put an implant there, and the other impact canine, just leave it there. But we need to make sure again with the CT scan to show that if the direction of the canine is convenient or efficient for the implant placement or not. Otherwise, we have to do other option, not the implant. Okay? So, besides the shape complaint, we have something else to talk about. Let's say about his bite. His bite is pretty good. He has a little gingivitis somewhere, as you can see here. So he needs some teeth cleaning, and I will show him how to do the proper oral hygiene again, to keep it oral hygiene. Okay? So, how about the bite and the right? I can see some old fillings here. The old fillings here, it's might need to replace. Now look at the occlusal part on the uppers. You can see now he has the old fillings, composite fillings. It's this color, but it still have an intact margins though. So I'm gonna leave it there. And after I check the x-ray whether it's good or bad, that's under the filling, so I can decide whether I should replace it or not. But here in the number 63, the milk tea, it says clearly class 2 cavity distally, so we need to fill it in if he wants to keep it. So in the lower arch, what else do we have? Now, Clearly, we have a very big class 2 cavity here, number 37 and number 47 in the muesli, okay? Furthermore, number 36 and number 46, we have the all fillings, composite all fillings, and I'm pretty sure same situation this, underneath it's a root canal, is an endodontic strictly T, but it doesn't have, it should be crowned already, but no, he just leave it there with a big composite, and it's a risk for me because after endo treatment, so the teeth is kind of fragile and it's very sensitive with the high force, especially with the number 6 lower like this. So we need to crown it if he wish to keep it longer. So let's take a look at the x-ray. What else do we have? Here is an x-ray of number 16. Okay, number 16. Let me show you what we have in here. Number 16 that we have might be a big cavity distally, number 16. There you see the partial radial illusions in distal that show us the big cavity underneath. But the patient have no pain, no discomfort at all, and I tell him that you might need to take more cautious with this teeth because it's gonna sensitive in a while and then it's gone. But sometimes somebody will have the pain in the tooth when they do something or even when they don't do anything at all. So that's a symptom of the pulpitis and you have to carefully follow it. So whether symptoms raise on, then you might need the root canal on it. But right now, I highly recommend you to do the root canal before the symptoms arise if you have the wish to keep it for longer. Now the lower, what else do we have in the lower? This is the lower right. Now as you can see in the x-ray, clearly in the clinical situation, we have the same findings that now he has a cavity, class 2 cavity on the number 37. Sorry, number 47, muesli. Again, number 46, it has root canal already. And now it has an open margin of the all fillings. Now it needs to be filled again before it gets foot impact and it destroys the root furthermore. So I highly recommend him to do the crown or endo crown to cover the occlusal surfaces to give the intact margin again, and it can spread the bite force evenly on the occlusal surfaces to keep it longer. Okay, that's the right side. Now we have on the left side, what do we have? The same situation and the clinical findings. What we have? The class 2 cavity on number 37 muesli. The number 36 is already have the root canal, but the all fillings is kind of a little bit better than the right side. So if he wants, he can do the crowns or endo crown on it, but if he cannot afford it, he can leave it later. Okay, so that's what I found in the clinical findings. So so to summarize the treatment plans for him, we have here. The first, he needs a teeth cleaning. Okay, that's a routine procedure, and then he needs to fill in the class 2. The class 2 on the 37 or 47, because it's kind of big and it's related to the occlusal surfaces, so I recommend him whether he's do the composite fill-in or if he can afford, it's even much better for him, he can do the inlay. The inlay is made of full ceramic. Okay, so that's the more durable options for him. Maybe it costs more for him, but it's more durable for sure, and it's more cosmetic for sure. So whether what suits him, he can choose. Okay, and now further we have crown. We have maybe the crown or endo crown on the number 37 and number 36 and number 46. Like I say. Okay. For the number 63, which is the residual multi, here we have two options. One, he can do the implant. Okay, then it means that he has to remove the milk teeth and put it implant, or he can do the ortho, which means that he still have to remove the milk teeth and he have to open the gap, the gum, so to expose the labral surfaces and pull out the impacted canine. So the overall treatment plan for him has been explained for him thoroughly, and he understands clearly about all the advantages and disadvantages of each treatment options. And what did he choose? Yeah, now he chose to do the teeth cleaning. Yeah, he was okay with that. And then he do the composite filling, which is fine for me right now, He do the number 37, 47, and number 63. I do the composite filling. And he will think about the crown or endo crown or what else he want to do with the number 63 later in near future, after he can afford more and he had more time to spend in here. That's fine for me, whether he understand thoroughly all the treatment plan. So the take-home message for this case is to thoroughly examine the patient with the clinical and the x-ray, and give him the overall treatment plan and explain for them the pros and cons of each option, so they understand clearly about their situation and they can give you the best decision that they can at the meantime or in near future. In near future, if he want to do the dental work, he will find you again to do what she say, and at this time he's really complying to all of your treatment plan, and that's the best signs for your high rate success in clinical. So I think if this case is useful for you, you can give me a like or comment or subscribe my channel so I can share to you more useful clinical case next time. Thank you for your attention. Goodbye.